everyone. My name is Danielle Phillips, and this is a drug infomercial on magic mushrooms. Today I'm going to be talking about magic mushrooms from the genus psilocybe, and these are naturally occurring psychedelic prodrugs that contain the psychotropic tryptamine psilocybin. Psilocybin is converted to psilocin in the human body, which has mind-altering effects comparable to the drug LSD. Psilocybin acts on the central nervous system and activates serotonin receptors in the prefrontal cortex, which affects mood, cognition, and perception. It is one of the most widely used recreational psychotropic drugs because it can be grown easily and inexpensively or even found in the wild. On the next few slides, I'll be showing you different types of magic mushrooms. On this slide, you can see Psilocybe cubensis, also known as the golden cap or Mexican mushroom. On this slide, we see Psilocybe semilanceata, which is also known as the Liberty cap. And on this slide, we see Psilocybe baeocystis, which is also known as the bluebell or bottle cap mushroom. Next, we'll get into the consumption of magic mushrooms. The product often comes dried or fresh. They are always ingested orally, however they do have a bitter and unpalatable taste, so users will often mix the mushrooms in with other foods. An alternative is to brew the mushrooms into a tea or extract, or pack the mushrooms into gelatin capsules to create mushroom pills, and in this case the taste and texture are avoided completely. Next, we'll go over the effects of magic mushrooms. So psilocybin affects everyone differently depending on size, weight, and health, previous use of psilocybin, use of other drugs, amount of psilocybin taken, and the strength of the shroom itself. Effects will begin in 30 minutes when eaten and will begin in 5 to 10 minutes when drunk as a soup or tea. The effects of magic mushrooms will last about 4 to 6 hours. Psilocybin has numerous effects on the human mind, the main one being tripping, which is defined as differences in mood, perception, and behavior. The user may see things in different colors and patterns, experience distorted sounds, tastes, and textures, intensified feelings and emotions, feelings of communing with a higher power, feelings of time speeding up, slowing down, or stopping, or an altered perception of one's place in the universe. Another effect is visual and auditory hallucinations, which distort the perception of actual objects and people in the environment. Psilocybin also has some effects on the human body, which include but are not limited to dilated pupils, GI issues, fast and irregular heartbeat, sweating, chills, dizziness, drowsiness, unusual body sensations, and yawning. On this slide, we'll go over the risks of magic mushrooms. One main risk is inadequate set and setting, the set being the emotional state of the user and the setting being the type of environment the user is in. If the user is in a poor mental state or a highly structured environment, they are more likely to experience a bad trip. So, new users are advised to have an experienced friend guide them. Another risk is intensified symptoms of mental illness in both diagnosed and undiagnosed patients. Another risk is leading to reckless behavior in an uncontrolled setting, such as driving under the influence of psilocybin. Another risk is overdose and the side effects that come with that. There are some consequences associated with magic mushrooms. Tolerance to psilocybin builds up very quickly, and something called hallucinogen persisting perception disorder is possible. This is when a magic mushroom experience reoccurs with visual distortions that involve perceptual or emotional changes. These can be disturbing, especially if the experience was frightening, and it can occur weeks, months, or even years after the psilocybin use. Psilocybin is a Schedule I substance, so it is seen as a high potential for abuse, no accepted medical use, and no accepted safety under medical supervision. However, psilocybin has been found effective in certain studies for treating depression, anxiety, and existential distress in cancer patients. Some cities are even decriminalizing psilocybin, and additional studies are expected to test its therapeutic effectiveness and safety. Thank you for taking the time to watch my presentation, and on this slide I've included a few more links to interesting finds on magic mushrooms and psilocybin.